South Africa continues to record about 240,000 HIV infections in a year, and cases are common among young women. Resources are poured into research, but the problem is complex, and there are no guarantees that we'll have a cure or vaccine soon. Developing an HIV vaccine is difficult, partly because the virus hides deep in a person's DNA. Well, where are we when it comes to the management of HIV? Joining us now, Professor Thumbi Ndung'u. Professor Ndung'u, good evening to you, and thank you so much for your time today. You know, the prevalence of HIV has been such a big issue in the country, and one of the worrying markers, despite how far we have come in managing this virus, is around the new infections that continue to take place, especially among young people.
Yes, thank you, Kathy, and thank you for having me on the show. You are absolutely correct. I think that we have made a lot of strides in the fight against HIV. It is a manageable disease nowadays, but we still have very high infection rates, particularly among young people. And so the HIV incidence, or the number of new HIV cases, is still very high in the country, and therefore we still have not won this fight against HIV/AIDS.
Let's talk about some of the driving factors behind those new infections not decreasing to the level that we would love to see. One would like to think that we have education and awareness around HIV being, at an incredible scale. There's There's so much information available to people. The taboo and the stigma associated with the virus is certainly not what it used to be in the past. But why are we still seeing the high rate of new infections?
Yeah, I think you're right. I mean, there has been a lot of improvement, particularly around the issue of stigma. And of course, as I mentioned earlier, there is antiretroviral therapy that is available. The problem that we have with HIV is that the current tools that we have to prevent HIV infections, to prevent new HIV infections, are not optimal. They are not ideal. So, for example, things like medical male circumcision, the use of condoms, these strategies, they work very well, but only when they are used. And because they are very much driven by behavior, it is very difficult for people to use them consistently. And so we need to continue to educate people so that we make sure that the current tools that we have against to prevent against HIV infections, such as condoms, such as medical male circumcision, pre-exposure prophylaxis, to make sure that people actually do use these tools and use them consistently. But we also need to realize that these are tools that are not optimal, and therefore we need to continue to develop the next generation of tools that will be used again in the fight against HIV/AIDS. For example, long-acting antiretroviral therapies, where you can get an injection that protects you for several months, rather than a pill that you have to take daily. If we had such tools, that would definitely go a very long way in our fight against HIV. And of course, the development of an effective vaccine, because a vaccine would be very cost-effective, would be very effective. It will be one shot that protects people for a prolonged period of time. And so we need to continue to develop new tools that we can use in the fight against HIV/AIDS.
One of the challenges that we're also facing as a country is the prevalence rate, particularly among women. And we know that women are considered amongst the most vulnerable groups in this country. And when we look at just some of the statistics of the comparisons between women who are HIV positive or who are living with HIV compared with men, there's still a huge gap. How much of the context that we live in as a country, and I'm talking here about the scale of gender-based violence that we have, are contributing factors to these figures? And one also just thinks about the rate of poverty, especially amongst women in this country as well.
We cannot run away from the fact that HIV/AIDS is primarily a socioeconomic disease. As much as it is a biological problem, in the sense that the virus has to be transmitted from one person to another, there are a lot of socioeconomic and behavioral factors around the transmission of the virus. And this is why you see this high vulnerability of women, particularly young women, because of the fact that we live in a country and in a continent where women are socioeconomically disadvantaged, and that facilitates the transmission of HIV/AIDS. For example, a lot of women, young women, are dependent on men for socioeconomic reasons. And as long as we have these inequalities in society, as long as we don't have economic advancement of people so that women can take care of their own bodies and their own destiny, we will continue to have this particular problem. I think we have tools that we have in our arsenal now to fight against the virus. As I mentioned, some of them like pre-exposure prophylaxis that people can use to protect themselves. But the socioeconomic factors and behavioral factors that women find themselves in this country and in this continent still make it very difficult for women to protect themselves against HIV.
All right. Steve Letsike, who is the co-chair of the South African National AIDS Council, also joining our conversation tonight. Steve, let me bring you in here and talk then about this issue of the high prevalence rate among women in more general, but specifically young women who at the age of 19 would be 4 times more likely than their counterparts to contract HIV/AIDS. This is something that was identified at the AIDS Council that was held in South Africa. I think it must have been around 2017 already, and a lot of noise was being made about it then. But it doesn't look to me that we are able to turn or change that situation around or respond adequately to the socioeconomic issues that enable what is happening.
No, in fact, thank you so much for the invitation, and really good evening to, my colleague there and to yourself and to the viewers of Newzroom. We are turning the tide, although at a very slow pace, but we are turning the tide. I think 2017, if you looked at the data then, we had over 2,500 girls between the ages of 15 to 24 that got infected weekly. But if you then look at the statistics, the data that is available, and even our own annual progress monitoring approach, we are below 800 new infection on a weekly basis, which then means our prevention efforts have been maximized, and we want to do that and triple our effort anyhow. So the attention given to adolescent girls, young women, the attention given to children, it's one of the biggest agenda that the AIDS Council is still working on. You would also realize some of the data that was released even late last year that raises concern around statutory rape, of girls, 9, 10 years. Already we've seen the pregnancies and so forth. And the Department of Basic Education have recently launched the Learner Pregnancy Management Policy, which then means we are actually responding. But I must agree with you. The concern around misogyny, patriarchy, and the dominance of men really reverses our gains, where we see sexual violence, where we see poverty, unequal status of girls, women, and men in society, really does reverse the gains. But also, young girls, adolescent girls remains key population. Women living with HIV remains key population, such as also including men who have sex with men, transgender, and other key population for that matter. It is a serious concern for us as the AIDS Council.
And let's talk then